Bonjour à tous et à toutes. Je m'appelle Marjolaine Tapin, je suis la directrice générale de Connexion TCC Québec, le regroupement des associations de personnes traumatisées crânio-cérébrales du Québec. Nos membres réguliers sont composés de 13 associations régionales d'action communautaire autonome qui viennent en aide à plus de 3000 personnes traumatisées crânio-cérébrales à travers la province, ainsi que 1 millier de personnes proches aidantes. Le regroupement offre de la formation, du soutien et des opportunités de concertation pour ses membres réguliers et sympathisants. It is my pleasure to introduce our next speakers, Tania Harris and Nakema Walker. Tania is a personal injury law clerk at Howie, Sachs & Henry, and he is currently the vice chair of the Diversity and Inclusion Caucus of the Ontario Trial Lawyer Association. Nakema is a service director for Bartimus Rehabilitation Services. She's a member of the board of directors of the Ontario Rehab Alliance. Helped establish the OIR Black Network and was awarded the Black Excellence Community Award 2022. Today, Tania and Nakema will be presenting on implicit bias.
Thank you, Marjolaine, for the introduction. As Marjolaine mentioned, the presenters today are myself, Nakema Walker, and Tania Harris. We would like to begin our presentation with a land acknowledgement. Today, we acknowledge that we are on the traditional territory of the many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And we acknowledge that the City of Toronto is now home to many diverse First Nations, Inuit, Métis people. We also acknowledge that Toronto is covered by the 13 signed with the Mississaugas of the Credit, and the Williams Treaty signed with multiple Mississaugas and Chippewa bands. As Black people whose African ancestors were enslaved and whose blood was shed to build this nation, we are committed to forming allies and solidarity with the Indigenous peoples. We are making it a practice to publicly acknowledge the history of the land that we are situated on. We do this to give back the identity of Indigenous peoples whose existence and struggles were unfortunately largely absent from the Canadian consciousness for hundreds of years. Take a moment to connect with the land that you are currently living on. We encourage you to reflect on your land acknowledgement and become aware of the history and the relations of this land and people. Our first story is about Matthew John Derrick. In December 2017, the Canadian healthcare system failed Matthew John Derrick, also known as John River. The then 24-year-old Black up-and-coming Canadian rapper went to the emergency room complaining of shortness of breath and severe headaches. It took 5 different visits to the emergency room before doctors took him seriously. And on the 5th visit, they gave him a spinal tap test for meningitis. A few doctors acknowledged that he needed a blood patch procedure, which is commonly performed after a spinal tap. However, there were also doctors who did not believe him. Those doctors accused him of exaggerating his symptoms and as a cry for attention, or faking his symptoms to get access to drugs. They even accused him of imagining his symptoms. Instead of getting the medical attention he needed, he was admitted to the psychiatric ward for 2 days. He was accused of being a drug user and seller. The Rivers family took to social media where they were able to find a doctor who was willing to treat him. The doctor soon discovered that John Rivers' brain was sagging in his skull due to low cerebral spinal fluid levels. The doctor believed that John Rivers' spinal canal had been leaking since that meningitis test took 2 months prior. Cerebral spinal fluid leaks are a common complication of spinal tap procedures. At this time, we would like to share the video of John Rivers.
Every year, millions of Canadians walk into a hospital or clinic to get treated, but as healthcare professionals themselves will tell you, not everyone gets treated equally. Studies and anecdotal reports have demonstrated how racism has impacted the level of care racialized communities receive. And John River, who you heard from earlier in the show, is just one example, and his story isn't unique. Following complications of a spinal tap test, John River visited over 5 hospitals in the GTA. looking for a doctor who would perform the emergency epidural blood path he needed.
Well, on day 30, can I get some help? It's not that bad. You're imagining it. Prove it to me.
He was experiencing extreme pain, vision loss, and lost sensation. But instead of getting help, the 25-year-old says he was oftentimes accused of faking his pain to get drugs or imagining it. It took 60 days to get that emergency procedure. And now that he's recovering, the Mississauga native is telling governments to tackle racism in healthcare.
I know, and you know, that in 3 months, there's going to be another young Black man who walks in the hospital and the exact same thing is going to happen to him, happen to me.
Notisha Massacoy, a health equity consultant, says Canadian healthcare isn't responsive to Black communities' needs, adding inequalities have long been documented.
Racialized populations, in particular Black populations, are having the worst experiences in the healthcare system, meaning their issues aren't being addressed fast enough, timely enough, appropriately enough, and therefore we're having more premature deaths. We're having higher rates of illnesses that should be preventable.
According to the Mississauga native, he was also told he was just imagining his pain and was admitted to the psych ward for 2 days. He was advised by friends and members of his community that race and stereotypes played a role in the level of care he received, and that he should avoid dressing a certain way, for instance, not wearing baggy clothing. On one terrifying day, his mom would go to extreme lengths to ensure what he was wearing wouldn't negatively impact him.
My mother was trying to fasten on a button-up shirt to my unconscious body on a stretcher.
Wow, what an unfortunate story. His mother had to put on a button-up shirt to his unconscious body just to ensure that her son got the attention that he needed. Implicit bias is a part of our everyday life. By way of definition, implicit bias, also known as unconscious bias, refers to our attitudes and beliefs that occur outside of our conscious awareness and control. Each time we interact with people, whether it is formally or informally, we are using our bias to judge them. Some biases are simple as which grocery store to buy certain groceries from, to which children we allow our children to play with. The problem is, we use our bias to judge others based on preconceived stereotypes rather than seeing people as individuals. Biases are formed from life experiences and what we have learned at home. Biases affect how we behave in the workplace and community. Our biases can impact how we handle and approach our clients. It is important that we understand as medical professionals, we are not immune from having biases. In this presentation, our goal is threefold: challenge, recognize, challenge, and interrupt. Learn how to recognize our bias to challenge them and interrupt them. Challenge. To challenge means to educate. Educating ourselves and becoming aware of our biases is not a way of shaming people. Rather, it is a way to take the necessary steps to unify and elevate as a society. Interrupt. With a client-centered approach, it is important that we understand how to manage our biases to improve the quality of care that we provide for our diverse clients. Many people are not affected by the biases of others in the healthcare system. However, many people are adversely affected by the biases of others in the healthcare system. As we move through this presentation, be aware of your discomfort. Be aware of your assumptions. Be aware of your anger, guilt, and/or denial. Take note of your responses, for this is the starting place for you to further explore your biases. I encourage us all to pause, reflect, and really be present in our bodies. This may not be the reality for you, but unfortunately, it is the reality for many people who access healthcare services in our Canadian cities. Recognize. Recognize that naturally, we all have biases. Recognizing is about self-reflection. Stop and ask yourself, what are my own personal beliefs? What are my biases? What do I believe about race and culture in society and in healthcare? What experiences have shaped my thinking? And in what ways does my racial and cultural background influence how I experience the world? What are some ways that we can recognize our biases? Well, we can start by listening. Listen, listen, listen. Actively listen to the client. We should be listening with our ears and not judging with our eyes. Let's not jump to conclusions. Let's stop and think about what has just been said. If you realize that you have a biased thought, don't suppress them. Understand them and reflect on them. Let's be inclusive and be open to different views. Acknowledge differences and appreciate them. The next story I'm going to share with you is about David Pantone. Although it is not race-related, it does show the implicit bias regarding mental health. On April 18, 2018, David Pantone attended a hospital in Toronto. He walked in with complaints of leg pain. At triage, he was asked what medication he was taking. And when he told them he was taking medication for bipolar affective disorder, the emergency room doctor ordered an MRI and at the same time referred him to an on-call psychiatrist. When the MRI came back clear, the assumption was that David's complaints were as a result of his mental health, anxiety. Anxiety is what was noted as the prominent symptom, not leg pain, not the fact that he could not walk, but anxiety. As soon as the diagnosis came in, David reports that the nurse came and took the blanket off of him and started saying things like, "Come on, get up, you're fine. There's nothing wrong with you." David could not walk. David struggled to stand, then ultimately ends up crawling toward the exit. What is really disturbing is the nurse walking beside him. David reports that she was saying things like, "You're a big boy, you can walk." When a gentleman approaches to assist him, the nurse tells the gentleman to move on. She was so desensitized and biased that she did not even have the courtesy to offer David a wheelchair to get him to the front door. Let's watch a video together of David Pantone and his family explaining his story in their own words.
David Pantone has been told to leave this Toronto hospital, but he can't walk. A nurse escorts him out. He remembers her words clearly.
"Get up, big boy. Get up. You can walk. You can walk. I know you can." I could not walk. I could not get up from that moment.
Pantone had arrived at Humber River Hospital complaining of excruciating leg pain that had worsened over a month. He also told the hospital he has bipolar disorder but is stable, but says that affected his treatment.
They thought, oh, he's faking it because he's bipolar. He's taking so much medication, so he's just faking it. I was not faking it.
The doctor came in, pulled the curtain, and actually said to Dave, "Come on, David, you can get up, you can walk. Get up, get up." She humiliated him, making him think that it was all in his head. How could you treat someone like that just because the MRI showed nothing was wrong?
It takes about 20 minutes for Pantone to make his way to the exit. In agony, he says, and humiliated.
He was begging for help and nobody helped him. They let him go like a dog outside. And nobody should be treated like that.
They didn't have a neurologist see David to see if there was something else wrong. They just assumed that it was mental health, and they discharged him so quickly without having someone else, another medical professional, to take a look at him. And that this cannot happen again. It just can't.
A few days after his experience, doctors at another hospital detect Guillain-Barré syndrome, a rare disorder where the body's immune system attacks the nerves. It took Pantone almost 4 months of intensive rehab to learn how to walk again.
How are you feeling?
The nerves, I can't feel the nerves.
Numerous studies have found too often healthcare professionals attribute someone's physical problems to their mental illness.
People with serious mental illness have 2 to 4 times or even higher mortality rates than the general population, which results in life expectancy of up to 25 years shorter than the general population, which is quite concerning and a call for action for us.
In a statement, Humber River Hospital said it was deeply troubled by what happened and that involved staff were dealt with accordingly. We've learned the nurse seen in the video was fired. It's unclear whether any doctors involved were disciplined. The hospital declined an interview request. David Montoni still finds it hard to watch what happened, but hopes sharing his story will lead to change.
It's just not right. It's just not right.
Erica Johnson, CBC News, Vancouver.
Deeply troubled. That is what the hospital said. How did you feel watching that video? What would you have done differently? What would you have said to the doctors who were discharging David at the time? What would you say to your colleague nurse as she was walking him out while he was crawling on the floor with no shoes on? Why was she so unsympathetic and uncaring that she allowed David to leave the hospital on the ground? Wouldn't it be great if we could sit down with the nurse and hear her side of the story? What made her think that watching a client crawling out of the hospital was okay? When offered help, why did the nurse think David was not worthy of some help? Where were the other nurses? Where were the doctors? Why did they think they shouldn't say something? And I know some of you may be saying there's another side to the story, and you're absolutely right. But what we do know and what we do see is a nurse walking beside a patient as he crawls on the floor, unable to walk out the front door. And what we do know is that David was diagnosed with another disease that had nothing to do with his mental illness. So how do we challenge our biased thoughts and actions? The first step, as Nakema said, is to recognize that you have them. And because you have them, you will make decisions and say things and act in certain ways unless you challenge those thoughts. Don't pretend you don't have them. Do not deny them. Do not deny them, sorry. As professionals, you must confront and explore your biases to avoid them interfering in the decisions that could impact on someone's life or even your own life. Taking the time to discover a bias that you may have against a certain social identity can help you to start understanding the biases that you have so that they don't affect you. The implicit bias test is a tool that you can use to address some of your biases. There's a link for it at the end of this presentation. I encourage you to take the test and go over it, the results, and reflect on your own biases. You may be surprised by the biases that we actually have. When assessing a client, we need to try and let go of some of our assumptions and biases. We should ask ourselves questions instead of assuming we have the answers. Get the information we need to come up with a plan or a diagnosis for your client. In the healthcare industry, there is no room for the cookie cutter treatment. Healthcare is not a factory. Each person is different. Here are some questions we can consciously go over in our head to challenge our biases when assessing a client. Am I listening to what is being said, or am I making assumptions? Am I making this decision based on my biases or what the client is saying to me? Am I basing this decision off of what race this client is? Am I doing everything I would do for my other white or influential clients with the same symptoms? In our next story, the healthcare workers failed to recognize and challenge their own biases against the Indigenous population. What happens in this story will shock you and upset you. When watching, think about all the things you would have done differently. Think about what you would have said to your coworkers and how you could have changed the situation. This is the story of Brian St. Clair. On September 19, 2008, Brian St. Clair, a 45-year-old double amputee Indigenous man, attended at a walk-in clinic. He hadn't urinated in 24 hours. The clinic quickly realized that they could not help Brian and put him in a taxi and sent him to the local hospital. The taxi driver pushes Brian in a wheelchair to the triage nurse and leaves him there. We can assume that the gentleman there tells him to go to the waiting room and wait. Time passes by, and Brian rolls over to the triage nurse, looks, and then rolls back to the waiting room. Brian then waits and waits and waits. Nurses ignore him and continue on with what they're doing, and Brian continues to wait. Brian even vomited on himself, and still no one came to his assistance. A security guard brought Brian to the attention of the nurse, but was told that he had been discharged earlier and had nowhere to go. 34 hours later, Brian was found dead in his wheelchair in the hospital waiting room. It is believed that Brian had died 6 to 7 hours earlier in his wheelchair. This situation has been dubbed ignored to death. Brian died from a treatable bladder infection caused by a blocked catheter. It was determined by the nursing staff that they observed Brian at least 17 times during his 34-hour wait, and not once of the 17 times did the nursing staff check on him. The nurses provided excuses like they thought he was drunk, or he was sleeping it off, or that he'd been already discharged and had nowhere to go, or that he was homeless and was seeking shelter from the cold. Did a bias against Indigenous people cause Brian's death? Let's stop and think about that for a moment. How could you have changed the outcome of Brian's situation? And I guess the question is, how do we interrupt these biased thoughts and actions so that no more Brians die unnecessarily? Systemically, simple answer is call them out, don't ignore them, say something. We need to let people know when their words, actions, or lack of actions are harmful, painful, and unacceptable. Had one nurse taken 5 minutes to speak to Brian, he would be alive today. Calling people out and challenging our biased thoughts or actions is going to be uncomfortable, and it's going to be hard. And you may feel like you're going to lose your job or be picked on or called out, but calling people out is necessary in order to change the narrative. How else do we make change? If each one of us takes the time to say something, it will help the next Brian get the proper care and attention that they need, and it will avoid unnecessary deaths. And this conversation is never easy. Not all of us are open to challenging our biased thoughts and actions. So here are some suggestions on what you can say to your colleagues to interrupt the biased thoughts or actions when you see them happening around you. First and foremost, slow down. If something is brought to your attention, stop, reflect, listen before acting. When speaking to your colleagues, you can say something like, perhaps you should take a step back and think about what you just said. Or, is what you just said harmful or offensive to your clients? Or you can say, can you tell me why you think that was funny? Or, is that a fact or an assumption? Let's review this together so I can understand where you're coming from. And lastly, you can say, I feel obligated to tell you why your assumption or action is not obligated. If the conversation is really inappropriate, it may be best to excuse yourself from the room, stating that you're uncomfortable with the direction of this conversation. Hopefully, this gesture will alert the person to their inappropriate behavior and make them think twice about their actions. Remember, once you've had a chance to reflect on the situation, you need to revisit it with your colleague. Do not let it sit and do not let it fester, as it will happen again. So what if you're the person making the inappropriate comments? How do you interrupt yourself and apologize? Interrupting ourselves would be to slow down, check our blind spots, go back, reflect, and ask questions. You can also think about some of the questions that Nakema went through and that were discussed earlier. And if you're not sure, speak to a colleague to get better insight. With regards to the apology should come from a genuine place and not just because you were called out or pointed out. If you do not understand how you offended someone, ask. Keep in mind that everyone may react differently to you asking them. If the first person is too upset or cannot answer you, be patient and ask someone else. Also keep in mind that not one Black, Asian, Indigenous, South Asian person speaks for their whole race. Some suggestions on how to ask are, I noticed that you're upset with something I said. Can you help me to understand it so I do not repeat this mistake? Or, do you have a minute to talk about what I said? Once you make an apology, do not keep bringing it up or keep apologizing. Move on, move forward, and try not to do it again. The simple rule is to respect everyone, regardless of their color, race, gender, or religion. You don't have to like everyone, but you do need to respect people regardless of who they are, where they come from, or what they believe in. The next short video is going to speak to our blind spots and challenging our assumptions.
11 million pieces of information every second. Yet we can only process about 40 of them. So we're wired to make cognitive shortcuts, using past experiences to make assumptions. And you know what happens when we assume. Our unconscious mind can put us on autopilot, determining where we sit, who we eat lunch with, who we turn to for advice, and who we choose to offer a helping hand. Living our lives with blind spots can put us in a tunnel. Same point of view, same decisions, same outcomes. We can find ourselves trapped in the land of snap judgments and misconceptions. We've all been on both the giving and receiving end of blind spots. Think about it. Who's talented? Who's able? Who can I trust? Who belongs? We've all been there. Blind spots are part of the human condition. Our choices have consequences for us and the people we interact with. By accepting that blind spots exist, we can stop. Imagine what possibilities exist if we could do it all over again. Different perspectives, inclusive relationships, diverse networks, better outcomes, seeing people for who they really are. People like you with unlimited potential. We all have blind spots. Once you accept that you have them, you can choose to do something about it. It's time to check your blind spots and focus on what's possible.
Thank you, Tania. So let's do a review and reflection. First off, listen, listen, listen. Make a conscious choice. Do not immediately jump to a conclusion. Stop and think about what has been said. Be deliberate, stick to the facts, discuss and justify your decision to someone else based only on facts prior to making your final decision. Pause and reflect on your potential biases before speaking or interacting with clients. If you realize that you have biased thoughts, don't suppress them, understand them, and redirect them. Put ourselves in our clients' shoes. Think about what you would expect. Do not stereotype clients. Think of them as individuals. Seek greater exposure to people who seem different from you or who you do not know very well. Be inclusive and open to different views. Acknowledge the differences and accept them. As we near the end of the presentation, there are some resources that we encourage you to read with an open mind. We also want to remind you to take the implicit bias test, and a link can be found following this presentation. Here are some reflection questions. Please take the time to go over them with your family, friends, and colleagues. We look forward to you joining us at the Howie, Sachs, and Henry booth to go over the reflection questions and some fun activities.
Thank you, Nakema. Well, this has been a lot of information to process, I know. You may be thinking, have I offended someone in the past? Has a client been mistreated, misdiagnosed, or felt ignored? Now I need to be careful of everything I say. The truth is, you probably have offended someone, ignored them, misdiagnosed. But going forward, We all need to be respectful of everyone, regardless of their color, race, gender, or religion. Make today the first day that you start to make an effort to address and confront your biases. It's a learning curve. You'll make mistakes. You'll say things that you shouldn't have or that are inappropriate. We're not perfect. What is important is that you recognize, challenge, and interrupt. Thank you.
Thank you.
And we'll take questions now.